Afternoon, everyone. I've been tasked by our lovely Jackie to talk about the T2 Day, which is a type 2 diabetes in the Young program, a new NHS initiative for people with early onset type 2 diabetes. My name is Kumar, and I've recently joined the SYICB as a diabetes program manager. Can you not hear me? Sorry. Is it better now? Perfect, thank you. So the aim of today's session is to brief you all on the T2 Day, which is, again, like I mentioned previously, it's a type 2 diabetes in the Young program. The objectives, so we're going to look at the case for change, we're going to look at the service model and the plans. So a bit of an introduction around the early onset type 2 diabetes. So EOT today is defined as the development of type 2 diabetes below the age of 40. It is more common in people from ethnic minorities, particularly in people from South Asian ethnicity and people living in the most socio-economically deprived community areas. What we also know is that a high proportion of people with EOT today are living with obesity and may also have unmet psychological and social needs. So let's look at the prevalence. Now, 2 years ago was the first time when the National Diabetes Audit specifically looked at the care, the characteristics, and the outcomes of people with young type 2 diabetes. And what it showed that the prevalence is increasing yearly. We are seeing a rapidly rise in these numbers. And those numbers are in excess compared to older onset type 2 diabetes. The latest report shows that we have got 137,260 people with young onset type 2 diabetes in England. The analysis also shows that most of the young adults are exclusively cared within the general practice, which equates to an average of around 3,300 adults with an ICS geography. And then when we talk about within general practice, that's an average of around 10 to 20 adults per GP practice. Does that number resonate within your GP practice? Yeah, I can see a few nods there. Now, when we look at the SYICB prevalence, we have got 3,600 young adults with type 2 diabetes. Now, I've split those numbers based on each of the places. So you can see in Sheffield, we have 1,580 young adults with type 2 diabetes. Doncaster, 805. Rotherham, we've got 720. And in Barnsley, we've got 580 young adults with type 2 diabetes. So why are we worried about this particular age group? What we know is that the early onset type 2 diabetes is associated with more aggressive diabetes phenotype than the older onset type 2 diabetes. It is also associated with rapid deterioration in glycemic control. It is linked with a worse cardiometabolic risk factor profile. We see early development of diabetes-related micro and macrovascular complications. And if we look at the significant reduction in the life expectancy, that's 12 years when diagnosed at the age of 15, 6 years when they're diagnosed at the age of 45, and 2 years when they're diagnosed at the age of 65. And this is what that makes this EOT2D as a high-risk condition. We also have noticed that there is an increased risk of adverse maternal and neonatal outcomes, and many of them are not well prepared for their pregnancy. Excess weight and risk factors relating to the diabetes are often seen at the time of diagnosis. So the big question is, should we be worried? I want to see a big yes. Yes, we should be. Now, there are many reasons to why. It could be multifactorial to why most of these young adults with type 2 diabetes are not receiving the care they should be. Now, what the recent analysis have shown is that most of the young adults with type 2 diabetes are less likely to receive their annual care processes. Is that right? Yeah. They're less likely to achieve a target HbA1c, and they're less likely to have their medications optimized. So this is why the T2 Day, which is the type 2 diabetes in the Young program, comes in place. So I'll talk a bit around what the T2 Day is. So just very recently, 2 months back, NHS England announced a national funding to improve the care for young people with type 2 diabetes. Each of the ICBs were asked to express the interest, which we did, and we have managed to secure the funding to improve the care for people with young type 2. The funding has only just reached the ICB. Early days for us because we're still planning the T2Day program. So the way the funding has been allocated is over 2 years, £52 per adult, and what NHS England wants us to do is to complete the 5 teams, which are completing any remaining care processes, identifying potential misclassification of diabetes, optimizing the glycemic control, contraception and planning, psychological well-being, and then signposting individuals to onward services. So as you can see, there is quite a medical model. It is very prescriptive. It does not really take into account the unique challenge what we face with these younger people, which is disengagement with the clinical services. So unless you get the young adults through the doors, you're never going to get the care processes completed. You're never going to optimize the control. You're never going to signpost them to the onward services. Again, the question, is the current model of care working? We do not know, because perhaps the model of care which is operational might have been designed at the time when the numbers were quite sporadic. And what we know now is the numbers are increasing rapidly. So this is what we thought should be our strategy and our model of care, that we focus on prevention. Now, although NHS England wants us to focus on people with existing type 2 diabetes, I think prevention is the key. We do need to make sure that we promote preventive care. Secondly, integration. What we also know that most of these clients are exclusively cared within the general practice. So what we need to have is a model of care that integrates primary care and specialist workforce in networks of care, so that we provide the skills to the healthcare professionals who are in a better position to look after these individuals. And more importantly, that's what our approach is going to be. Our strategy is going to be compassionate, it's going to be humanistic, it's going to be holistic, and we're going to work a lot on the engagement side of things, whereby we are going to develop non-traditional ways to engage with young people with type 2 diabetes. So let's look at the aims of our strategy. So like I mentioned in my previous slide, I think it's key that we work around prevention. We identify people who are at risk of early onset type 2 diabetes. We work on improving the engagement so that we can improve the outcomes for the young adult. Now, I'm not quite sure, but if you are aware around the specific clinical guidance that's actually available for early onset type 2 diabetes, Sheffield is the only place which have got this clinical guidance in place. But the clinical guidance is quite pharmacological led. What we really want to see is non-pharmacological intervention, like the weight remission program, to be in place. So we have got a Dr. Song who is going to be the clinical lead to work on incorporating those specific clinical guidelines that makes age-related recommendations. Our strategy is also going to help identify groups who are particularly at high risk. Again, our approach will be data-driven. Skills development. With the funding, we're planning to organize around 2 training sessions over the next 2 years. We are going to ensure that we identify the correct diagnosis. We pick the misclassification of diabetes. Now, we've talked about the model of care. We do not know what model of care does actually work for this individual, so we are going to work very closely with the research team to fill in the research gaps. So when the funding was announced, like I said, just early days for us, and we've only just received the funds, what I did was a bit of a deep dive, went to each of the places, Sheffield, Barnsley, Doncaster, Rotherham, to understand what is in place, what the gaps are, what could be done better, and what could be avoided. So we created a working group, and then we identified work streams. So the work streams, one, is around communication, engagement, and peer support, which would mean that we are going to invest some of our funds to get an engagement provider in place. We're going to recruit a health and well-being coach who would help with coaching and mentoring. We're going to look at creating a peer support for type 2 diabetes. We do not have peer support for type 2 diabetes. There's a lot of work that's been done around type 1 diabetes, but again, a lot of work that needs to be done for young adults with type 2 diabetes. The work stream 2 is going to be led by Dr. Song. We're going to look at clinical guidance. Work stream 3 is going to be around preconception, pregnancy. So part of the funding is going to be invested to get a diabetes specialist midwife who can help with the preconception side of things. Mentioned about data collection. Work stream 5 is around structured education. Again, we have got a work stream for that, and we've got a clinical lead who's been identified to work on it. Work stream 6 is around designing a T2Day diabetes page. Now, within the clinical system, Ardens have actually created a T2Day template, and what many of the practices do not have is Ardens in place. We're going to try to create a T2Day diabetes page whereby we will have all the information in one place, and we can ensure that most of the care processes gets completed at the same time. So this slide is empty because we're still at the planning stage, and I'm hoping that I will get invited next year and I come and talk about what work we have done. Just very quickly, just introduce our team. As I mentioned, I've only just recently joined the SYICB. We've got Richard and Elizabeth, who are the clinical leads. Jane Croft is the head of commissioning within Sheffield, and she's been helping me with this project. And Dr. Soon Song is a clinical lead for the T2Day. So I'm hoping that I have convinced everyone that early onset type 2 diabetes is a high-risk condition. It's an age group that requires urgent attention. So to summarize, early onset type 2 diabetes in the young is a worrying with a rapidly rising diagnosis. And like I mentioned, it's an extremely high-risk condition. It disproportionately affects those from minority ethnicities, particularly Asian, and those living in the most socioeconomically deprived areas. What we need to have is targeted strategies that are required to address prevention, treatment, and risk factors. And it also would benefit from a segmented focus on this younger group that incorporates people in full-time education, those of working age, and potentially demanding employment, and women of childbearing age. So what I need from you is for people who are interested to improve the outcomes of young people with diabetes, get in touch with me because we're still within the planning phase. I do want all the support. I do want all your intelligence and insight that can actually help us to pull this model and the strategy together. Put my email address there, so do get in touch with me. Thank you.